Good evening, everybody, and welcome to this channel where we are thriving with sickle cell. Last time we had a conversation, we talked about some habits that we could form, we could prepare for, and all of that to help us reduce the severity or the frequency of a sickle cell crisis. And of course, to help us live, easier and better and definitely away from the hotels, in quotes, hospitals. Today, we're going to be talking about what I meant when I said a crisis. Sickle cell patients and crises are like bread and butter. It's the bane of someone who is living or thriving with sickle cell. However, there are things that we can do as sickle cell patients that can actually improve the outcomes and reduce the frequency or severity of the sickle cell crisis. I'm going to talk about two forms of crisis today. And the first one is the vaso-occlusive crisis, while the second one is a sequestration crisis. One of them is more acute than the other, and a vaso-occlusive crisis could end up becoming a sequestration, or a sequestration could end up becoming a vaso-occlusive crisis. You don't really know which one of them comes first. But sometimes you could just have a sequestration without a vaso-occlusive crisis. What the heck is a vaso-occlusive crisis? That is what a lot of sickle cell patients talk about. It is that bone pain crisis that people feel. That thing that makes you have a lot of pain. That throbbing, continuous pain in your arm, on your leg, on your back, or sometimes everywhere all at once. I'm not kidding you, it's the worst thing you can ever think about. Maybe somebody who was having a baby, I've never had a baby before, will be able to experience or tell you what that pain was like. Or you broke a leg and you're feeling pain. That's kind of almost what you feel when you have, a vaso-occlusive crisis. What is really happening behind the scenes is that more sickle than spherical, which I explained in my first video. Please, if you haven't watched it, go back and watch it. They're more sickle than spherical, and when that happens, it actually blocks the flow of blood and transportation of oxygen to parts of your body. When the flow of blood cells or the blood is blocked, guess what? It starts giving you that pain. Now, it could happen everywhere all at once in your body. That science I cannot explain, but I can tell you that I've experienced it many times. But I'm not here to tell you about the woes or the challenges of the sickle cell patients. I'm here to tell you about how to thrive with some of these things. Now, the first thing is, how do you reduce the frequency and severity of a vaso-occlusive crisis? That's a tough one. You never really know when it's going to happen. But guess what? After a few tries, you can start listening to your body, right? As an adult, you want to listen to what your body is telling you sometimes. Reduce exertion, reduce stress. I talked about those two things. You want to manage those two things very, very seriously. Now, that doesn't say don't exercise. Absolutely exercise, but exercise in a controlled manner, in a way where you're not putting too much pressure or breaking down too much of your red blood cells or breaking down all the oxygen in your body to exercise. So moderate exercise is what doctors recommend. I try to do some things. I'm not very religious about it. I pay attention to what goes into my body in terms of food more than exercise. So it depends on what you want to do. I'll recommend, of course, some type of brisk walking. I play ping pong and things like that. So exercising is definitely very important, but at the same time, you don't want to exercise to the point where you don't have any oxygen in your blood cells anymore and you're now panting and of course you end up in a crisis. I did that a lot as a kid, and that's typically how kids operate, even up to university, because there are no real consequences. Yes, you miss school, you miss class, you come to class, from the hospital, you take exams. Right after the hospital, you sit down in the chair by yourself and write your exams. Yeah, all those things are normal, no consequences. But when you start working, there are real consequences, because if you don't show up at work, you start looking unreliable. You don't want to look that way, right? So you want to become a reliable staff. You still want to show up, you still want to give your best possible. You don't want them to give you some type of preferential treatment just because you're sickle cell. Even if you get it, it's not something that can be sustained. You don't look at you as that staff that everybody wants on their team. It's that staff that you don't really want on your team. So it's important that you get a wrap around some of these things, and that's what I'm talking about. So one of the tricks is you've got to listen to yourself. You've got to manage exertion. You've got to reduce stress. When you do that, the possibility of you actually reducing the frequency of a crisis is actually there. Of course, you want to manage exposure to infection. Very large crowds, very large environment, dirty food, not so clean food. I like buka food, I won't lie to you. I went to a lot of restaurants that were not necessarily, 5 lifestyles to go and eat. All of these things are not the best for you as a sickle cell patient. You want to be more careful about some of these things. So that's one tip that you can actually start today. As a parent, what do you want to do for your kids? Help them to take a break, tell them to rest, watch them, pay attention to them, see the signs, the triggers, and once they tell you things like I'm tired, I'm not feeling well, expect that it's possibly a crisis and you want to actually pay attention to them a little more. Sometimes you could actually get them to go to bed early, give them more water, encourage them to drink more water, and if necessary, absolutely see your doctor. One of the things that happened as I grew older is that there was a medication that came to life. It's called hydroxyurea. What is hydroxyurea? It's a medication that originally was meant for cancer patients, but it found was very useful in sickle cell patients. And what does it actually do? It increases production of fetal hemoglobins. Aha! That's a new one. What's fetal hemoglobin? Hemoglobins are produced in your mom's womb before you were born that kept a sickle cell patient alive initially when you're a child, so you're not having so much crisis. But when you get older, it naturally reduces. Remember, it's fetal hemoglobin. So when you use hydroxyurea, fetal hemoglobin is induced for production. It starts getting produced a little more, and that actually stops your red blood cells from sickling. That's a big deal. That's a very, very good therapy. There are other things that they do today, gene therapy, bone marrow transplant, and all that. That's a different conversation for a different day. But when you have a crisis, when you start using hydroxyurea, it does reduce the frequency of a crisis. So consider using it. It does have side effects, no doubt about it. For me, one of the things I can see here is that my nails are, darkening here and there. Other than that, there's really not much to it. Your doctor is the best person to tell you what dose to use, how to use it, and share with you what potential side effects that you could expect. Definitely monitor yourself. Make sure you're being monitored once you get on it. I go to see a doctor regularly, maybe like once every quarter or once in 6 months, just for a checkup. I do tests, they have seats, and they just let me be. Now I live in Canada. That's easy. Of course, I know we don't all live in Canada, and there are very big constraints around where we live. But it's important to know these things because sometimes if your doctor is not doing it, you are your doctor. Your parent is your doctor. Your friend is your doctor. Go out there and ask, why are you not doing this? Can you get this done? Of course, I'm sure that at some point, for some people, concern is not necessarily is the doctor doing it or willing to do it, it's funds. Well, that's the part where we hope that wherever you find, of wherever country you are in, is able to pull the resources to manage, sickle cell more adequately. Remember, I said 2 types of sickle cell crisis. The first one is what we've talked about, vaso-occlusive crisis. The most common one that everybody talks about is bone pain. That's it, the one that hurts you. But the second one that a lot of people don't talk about as much is the sequestration crisis. Now, sequestration crisis is interesting because some people have it, some people don't. Like, one of the things I say to people is that there's no 2 exact sickle cell patients anywhere in the world. What you experience could be similar but also vastly different. So I had a lot of sequestration crisis growing up, and what was happening is that I had a large spleen whenever it happened. What does that mean? Red blood cells were getting trapped in my spleen. My spleen wasn't working the way it was supposed to work, right? So when that happens, I am exhausted. I am tired. I can't even walk. Sometimes I can't move. It did take me a long time to understand this. But my doctor explained to me very early on. Some things I couldn't do. I couldn't play some type of sports. I couldn't play a lot of contact sports. I couldn't do anything because if I got hit around the spleen area, it could actually get ruptured. If it gets ruptured, difficult for you to survive that. So that's something anyone who still has a spleen should actually pay attention to. For me, I don't have any spleen anymore. In the last 2 years, it had to be taken out because I'd had too many frequencies or too many occurrences of a sequestration. My doctor said, look, you don't want to get into a situation where you'll be shocked, which is a complication of sequestration crisis. Recall, sickle cell itself is not the problem. It is the after effect of sickle cell. It's the complications that arise because of sickle cell that are the problem. So what would I tell you is that monitor yourself, pay attention, right? So that you don't have a sequestration crisis. Drink lots of fluid, and if you feel tired and all of that, go see your doctor. Now, one thing you can also do for yourself is to know your stable PCV or your hemoglobin count. That is a very important number because it then helps your doctor to know how far away you are from your regular or normal state. So your stable PCV or regular count is what you do anytime you want to see a doctor and run a blood test, and they know that, okay, if you're fine, there's nothing wrong with it, that's what you have. You always need to know that number, because when you're not feeling well, knowing that actually can help the doctor quickly triage and say, this is probably what is going on. Of course, your spleen, if it's enlarged, is enlarged. They can see it and they can feel it. But if it's not enlarged, it might not be as easy for them to quickly figure out. So you need to let them know. Now, the other thing you can do is manage your environment. Infections are one of the things that leads to all types of crises. Please manage your environment. When you manage your environment, what you're typically doing is that you're reducing any source of infection. So make sure your countertops, your plates, and all that hygienically. Clean your hands often. Wash your plates away. Things that lead to unseen bacteria, whatever it is, make sure it's clean. You may begin to look like a germaphobe or an OCD infected person, but guess what? It is what it is. You are interested in your survival and your longevity, as I am interested in my survival and my longevity. So my recommendation to you is that eat healthy, eat clean, think hygiene, all situations, reduce crowded areas. Don't put yourself in a situation where you could actually get things transmitted to you, because it might affect you differently from every other person. So that's one way to reduce things like a sequestration crisis. There's no real science behind it. They don't know what the triggers are 120%. I'm not going to lie to you, but they know how to manage it when it occurs, right? So you have to make sure that you're trying to help them to help you manage it, and also know it. The other thing you can do about it actually is to pray. Now, some of us live in areas where we have lots of malaria, all of that, and we're sickle cell patients. Honestly, my recommendation to you is ensure to not get malaria. I know that's difficult if you live in a place like Nigeria. Very, very difficult when they tell you that everybody just has malaria, some form of it in their body. And that always triggers a form of crisis, including sequestration and all of that. Honestly, the best form, I'm not even kidding you. Number one, paludrin. Some type of prophylactic, that's what they call them. Use it regularly. The second thing is actually sleep under a mosquito net. Those things are actually the most effective. I'm not going to kid you. Mosquito nets are the most effective. You might look odd, you may look not fancy, you would hate your room, all of that, but sleep under a mosquito net. I did that several times in my life, and I can tell you that helped me. Did I actually do it as consistently as I should have? Probably not, because I just hated the aesthetics of it. But I'm recommending to you, please give it a shot and see how it goes. Everybody always has malaria, but sickle cell patients are affected differently when they have malaria. It triggers a crisis, vaso-occlusive, or sequestration. And when you have any of those two things, every other thing up in the air. So you want to reduce that. Finally, I'm going to remind you that if you have any question that you want to ask me, feel free to go ahead and send your email to me at thrivingwithsicklecell01@gmail.com. You can send that email, whenever, and I'm going to try my best possible to answer any question you have. Questions that I don't have, I guarantee you, I'll get a doctor here to talk to you about it. And I mean what I'm saying. So feel free, go ahead and ask those questions. Bottom line, you can thrive with sickle cell. You can live to the octogenarian, and I believe in you as you believe in yourself. God bless, and see you next time.